Hello, I'm Dr. Pallavi Desai. Today I'm going to talk to you about a common condition called pelvic organ prolapse. Did you know that almost 1 in 2 women will suffer from some degree of pelvic organ prolapse, or commonly known as vaginal prolapse? So what is prolapse? In women, there are 3 organs in the pelvis, namely the bladder, the uterus with the vagina, and the rectum. When there is looseness or laxity of the tissues and muscles supporting these organs, they tend to descend from the normal position, and this condition is called prolapse. Now, how do I know that I have prolapse? Many women are unaware of their prolapse because it's minimal. However, in many other women, it causes some symptoms like a bulge that worsens with standing or lifting, bladder symptoms like inadequate emptying and the need to go more often, or difficulty in passing motion or an incomplete evacuation. There may be discomfort during sex and a feeling of being loose down there. However, many women do not talk about it due to shyness or think it is something inevitable and not much can be done about it. But it is best to see a specialist who can guide you about your condition and your management options. Question asked is it dangerous to have prolapse? If the prolapse is mild to moderate, which is grade 1 to 2, it is not dangerous. However, higher degrees of prolapse like grade 3 to 4 can cause pulling and obstructions of the ureters, which are the tubes going from the kidneys to your bladder and carry urine. And this can cause damage to the kidneys and should be treated. Is the prolapse cancerous, is the question? Prolapse by itself is not at all cancerous. However, it is important to have regular checks with screening, with cervical screening tests and examinations to rule out any kind of cancer. How is prolapse treated? Not all kinds of prolapse need surgical management. Most often we treat it with conservative methods. You may be referred to a pelvic floor physiotherapist who can help you utilize your pelvic floor muscles optimally and improve their strength, and quite often this is all that is required. There are other means like having a device fitted into the vagina to keep all the organs in the place. This is a silastic device called a vaginal pessary. It can come in many shapes, sizes, and forms. These are inserted into your vagina by a professional, but you can be taught to remove and reinsert it yourself. If a woman has many symptoms and the conservative management does not work or is not agreeable to the woman, she can opt for surgery. What other conditions can coexist with prolapse? Apart from general gynecological conditions like heavy periods, many women, about 1 in 3, suffer from urinary incontinence, which could be the main bothersome symptom. This can be due to an overactive bladder, which is called urgent continence, or a weak sphincter of the bladder, also called stress incontinence, where the stress is an increased pressure on the pelvic floor when you cough or sneeze or lift heavy weights. Is the surgery complex? Surgery for prolapse varies according to the needs of the woman and the anatomical changes that have happened. However, it is complex, but in good hands it's quite safe. Where can I get more information? First, see your specialist, and then they can guide you to information resources. A good information resource is called yourpelvicfloor.org.